What are the diagnostic criteria for BPS? Imagine trying to solve a puzzle where the pieces are symptoms that can look like many other conditions. That's what diagnosing bladder pain syndrome involves. Also called interstitial cystitis, it's mainly diagnosed through careful clinical evaluation. Doctors start by listening closely to your story, how long you've had pelvic pain, what makes it worse or better, and how often symptoms occur. For a diagnosis of bladder pain syndrome, these symptoms need to last at least 3 months. The pain is usually felt as a persistent or recurrent pressure, discomfort, or burning sensation in the pelvic area, and it often gets worse when the bladder is full and eases after emptying. Along with this pain, most people experience other urinary symptoms like needing to urinate frequently, feeling urgency, or waking up at night to go to the bathroom. These symptoms are common but must be evaluated carefully. The next step is to rule out other causes that could explain the symptoms. This means tests like urine analysis and cultures are done to check for infections. Doctors also look for signs of other issues like bladder cancer, endometriosis, or pelvic floor problems. Imaging tests or bladder diaries might be used to gather more information, but they don't give a definitive diagnosis on their own. Sometimes, a cystoscopy is performed, which involves looking inside the bladder with a small camera. This can reveal Hunner lesions, which are specific bladder ulcers associated with a subtype of interstitial cystitis. However, the absence of these lesions doesn't rule out BPS. It's important to know that there are no specific blood tests or biomarkers that can confirm bladder pain syndrome. Diagnosis is mainly based on clinical judgment and the process of exclusion. The goal is to identify the pattern of symptoms that have persisted for at least 3 months and to ensure other conditions are not causing the pain. Because symptoms can overlap with other serious issues like bladder cancer, a thorough evaluation by healthcare professionals experienced in bladder health is essential. Remember, each person's experience with bladder pain syndrome can be different, so personalized care is key. If you suspect you might have BPS, consult a health care provider to get a proper assessment and tailored treatment plan.